Hi, this is George with 573 Medicine, and in this video we're going to be doing a brief review of false ribs in the sternum, as well as talking about structures of the abdomen. So let's get started. The very first thing we should remember is that humans have 12 pairs of ribs, and the first through seventh pairs have cartilage that articulates with the sternum ventrally, and they're called true ribs, whereas the 8th through 12 pairs are called false ribs, and they do not articulate with the sternum ventrally. The cartilage of false ribs do not articulate with the sternum ventrally. Collectively, these false ribs end up creating this area, which are each known as the costal margins, and together the two costal margins create the infrasternal angle. We should also remind ourselves of the xiphoid process. And the xiphoid process is the attachment for the rectus abdominis and diaphragm. Additionally, excess pressure should be avoided in this area to avoid puncturing the diaphragm or liver. Now that we talked about false ribs and the structures of the sternum, let's talk about abdominal structures now. The very first one we're going to be talking about is the linea alba. And the linea alba is a fibrous structure that extends from the xiphoid process to the pubic symphysis, which is the anterior attachment of the pelvic bones. There aren't any nerves or blood vessels in the linea alba, so surgical incisions often occur here. The next structure we're going to talk about are the tendinous intersection. So the linea alba is pretty midline, and the tendinous intersections are going to be these transverse bands that assist in flexing the lumbar spine whenever you're like doing a sit-up or something, as well as cross the rectus abdominis muscle. Next, we're going to be talking about the linea semilunaris, or the semilunar line, and this is an area where the tendons of the rectus abdominis and the obliques meet. Next, let's talk about all the muscles of the abdomen and get a big picture view of this. So here we can appreciate pectoralis major, and then we can appreciate serratus anterior, which isn't labeled, and then we can appreciate external oblique. And the external oblique is the largest and most superficial abdominal muscle. It originates on the external surfaces of ribs 5 through 12 and inserts on the linea alba, pubic tubercle, and iliac crest. And these function to pull the chest inferiorly and compress the abdominal cavity, as well as rotate the abdominal cavity. Deep to the external obliques, we have the internal obliques, and whenever you're in lab, pay attention to the direction of the fibers, because the directions of the fibers are going to be perpendicular on the internal oblique relative to the external oblique. The internal oblique attaches to the inguinal ligament and the iliac crest, as well as inserts on the linea alba in ribs 10 through 12. And the internal oblique is a accessory muscle of expiration, which compresses the abdomen to push the diaphragm superiorly during exhalation. The next is the rectus abdominis. And the rectus abdominis, we can appreciate deep to the internal oblique. And the rectus abdominis originates on the pubic crest and the pubic symphysis, and it inserts on the costal cartilage of ribs 5 through 7, as well as the xiphoid process of the sternum. It functions in posture and flexing the lumbar spine, as well as doing a crunch and sit-up. Additionally, we have the transverse abdominis, which is deep to the internal oblique. It originates on the inguinal ligament, iliac crest, inner surface of ribs 7 through 12, and inserts on the linea alba, xiphoid process, and pubic symphysis. Additionally, the external oblique, this isn't written here, but it should be, is a muscle of, an accessory muscle of inspiration. So the external oblique is an accessory muscle of inspiration, whereas the internal oblique is an accessory muscle of expiration. The transverse abdominis functions in forceful expiration as well as stabilizes the abdomen. So this is unfortunately one of those things that you have to kind of sit down and memorize, but when we're talking about the abdomen, we should understand the layers of the abdomen. So most superficial, we have the skin. Just deep to the skin, we have the superficial fatty layer of the superficial fascia, specifically the fatty layer of the superficial fascia. And this is known as Camper's fascia. Deep to Camper's fascia, we have the membranous layer of the superficial fascia, which is known as Scarpa's fascia. Deep to the superficial fascia, superficial membranous fascia, deep to Scarpa's fascia, we have the external oblique muscle.
Deep to the external oblique, we have the internal oblique. And deep to the internal oblique, we have the transversus abdominis muscle. Then we have the transversalis fascia, as well as the parietal peritoneum. Deep to the parietal peritoneum, you'll have a cavity known as the peritoneal cavity, and then lining the abdominal organs, you're going to have the visceral peritoneum. A few things to note is that when I was in lab, I just remembered the line, a fat camper may starve. So fat, so superficial fatty layer in camper's fascia, and then may starve membranous and scarpus fascia. That might help you. And pay attention to the transversus abdominis, internal oblique, and external oblique, because from deep to superficial, it spells the word tie, and that's going to be important later whenever we talk about structures in the inguinal region. So that's it for this video. If you liked the video, please like, comment, and subscribe. Also, feel free to email us anytime at realtalkmeded@gmail.com for any questions, comments, or concerns. Thank you so much.